As an experienced HIV provider, what role do you see the primary care provider playing in the management of HIV?
I see the primary care provider as someone who, one, needs to make the diagnosis. So we have to get people in all walks of medicine to understand and incorporate the 2006 CDC guidelines that say every person 13 to 64 needs a test. And if you're older than 64, in my opinion, if you've had sex within the last 10 years, you still need a test. We need to make sure everyone knows their status. That's for their personal health. It's for the health of the public as well. So one, we have to get practices testing. Two, when they find somebody, I would like to see them comfortable with keeping that patient in their patient-centered medical home or their FQHC. If they need help, making sure we have mentors, providers that can help. Because a 20-year-old now with HIV, if he does things right, can easily live to be 70. And along the way, HIV is just one small part of his care or her care, because women are going to have babies. We continue to have cervical problems and abnormalities. We continue to see hypertension and diabetes and obesity and smoking and all of the things that we have to help people with. So HIV is one piece of a life that a primary care provider needs to take care of all of those things. And we have artificially separated out the HIV, and for many years it was very difficult. And there were a lot of pills, and it was not a very easily done process to keep up with medications. Things are different now. You make the diagnosis, you make sure you do a genotype, you do some other basic laboratory studies and make sure you know what the comorbidities are or aren't, and then you talk about therapy. And you don't have to decide when to start therapy, because the current guidelines say everyone who's known to be infected needs to be on HIV therapy. If indeed they decide to start, they have to stay in care. Adherence to medications and retention in care, we know, are the two most important things for the long-term health of this population. Well, that's no different than diabetes and hypertension and all the other things for which people need good quality follow-up care, good adherence, and a regular care provider, somebody that knows them.